Alright guys, we're going to talk about IM or intramuscular injections. For that we're going to use a 1cc syringe and ideally a 22 by 1 inch needle. I don't have a 22 so I'm using an 18. Don't use an 18 on anybody. Okay. So first thing we want to do, PPE, we're going to assess our patient's level of consciousness. We're going to check their ABCs, make sure they have a pulse. We're going to assess for any signs of opiate overdose, anaphylaxis, nerve agent exposures. If we do have evidence of any of that, then we're going to apply O2 and we'll prepare to administer the appropriate medication. On this, I'm just using this as the skill video to show you how to actually do the skill, not talk about the pathophys of why we're doing what we're doing or anything like that. So first thing that we're going to want to do is I'm going to piece together my needle and syringe, keeping a sterile technique, so everything's still sterile. We're going to select the appropriate medication, which minus the oxygen, let's go ahead and say that this guy was a heroin overdose, so we're going to go ahead and give him Narcan. We want to make sure that the medication itself, that the concentration is what we want, so 0.4 milligrams in 1 ml. We want to make sure that the clarity is good, so we want to look at our vial, make sure that it's not some yellow or brownish color, and we want to make sure that it's free of any particulates, so we don't have any random floaties in there. I do want to go over Dr. PATS, which is a mnemonic for you. Dr. PATS stands for right drug, right route. So Narcan, intramuscular, right patient, John Doe here, right amount. I'm going to draw up 1 cc since it's 0.4 milligrams in 1 cc. So I'm going to go ahead and draw up my 1 cc. Prior to drawing it up, we do want to open up a alcohol swab, clean off the top of our vial. I'm going to use the two-handed technique so that I make sure that I'm not going to stab myself. I'm going to insert the syringe that is full of air. I'll inject the air, and I'm going to withdraw my fluid. So that. Knock out my bubbles. So that's the right amount, 1 cc for 0.4 milligrams. T stands for time. The time is whatever time it is now. And S is scribe, meaning that I'm going to document what medication I gave, what route I gave, why I gave it, when I gave it, and what the adverse or what the reaction to it was. Was it improved, not improved? For an IM injection, I'm going to go in the deltoid here. So I want to find the nice, meaty, fat portion of their shoulder. I'm going to clean using an alcohol swab with a circular outward going bullseye so that I don't pull any contamination back into my site. For IM, I'm going to spread my skin. I'm going to take my needle in one swift motion. I'm going to insert it 90 degrees to the skin, so 1, 2, 3. I'm going to aspirate by pulling back on the plunger to make sure that I don't get any blood coming back up into the syringe. And then I'm going to inject the syringe, pull it out. That immediately goes into the sharps container.